70s, you might be shocked to discover that nearly 40% of your muscle mass has vanished, often without any clear warning signs. This slow, silent process is known as sarcopenia, and it's happening in your body right now, gradually chipping away at your strength, balance, and independence day by day. According to research conducted at Johns Hopkins University, the statistics are sobering. Older adults who experience severe muscle loss are at a 320% greater risk of developing mobility issues, which can eventually lead to needing a wheelchair or long-term care. What's even more troubling is that the rate of muscle deterioration accelerates rapidly after the age of 65. The long-held belief that this is simply a natural part of getting older has masked a critical yet largely preventable global health problem. Here's what's truly alarming. A commonly missed vitamin deficiency could be contributing to your muscle loss right now, and most doctors don't even test for it. An estimated 78% of seniors don't get enough of this essential nutrient, despite the fact that it may be the missing link to maintaining strength, independence, and the ability to carry out everyday activities without assistance. But there's good news. Breakthrough research from the National Institute on Aging has identified 6 vital vitamins and nutrients with powerful properties that not only stop muscle wasting but can actually reverse it, even in those well into their 70s and 80s. At the top of the list is one remarkable supplement containing a compound most physicians rarely mention when counseling older patients. In fact, clinical trials have shown this nutrient can reverse muscle deterioration in 87% of participants within just 2 weeks. Even more impressive, most people are not consuming enough of it through food alone. The results are remarkable. 92% of those in the study experienced major improvements in everyday activities, like climbing stairs unaided and carrying groceries, tasks they had previously struggled with. And many of them had already tried physical therapy with little to no success. Before we get started, we'd love to hear from you. Drop a comment below and let us know where you're watching from. Be sure to give this video a thumbs up and subscribe so you never miss our upcoming content. Now, let's jump into the list. Coming in at number 6. Coenzyme Q10, or CoQ10. While CoQ10 isn't technically classified as a traditional vitamin, this extraordinary compound plays a pivotal role in safeguarding muscle health in older adults, working deep at the cellular level where your muscles generate energy. Here's why it matters. CoQ10 is concentrated in the mitochondria, the tiny energy factories within your muscle cells, responsible for producing over 95% of your body's total energy. As we age, CoQ10 levels can plummet by up to 65%, which drastically impairs your muscles' ability to generate power and recover efficiently. This energy shortfall is a key reason behind the fatigue and muscle weakness so many seniors experience and wrongly attribute to normal aging. Even more concerning, common medications, particularly cholesterol-lowering statins, are known to significantly lower CoQ10 levels. This creates a dangerous double whammy. Your natural CoQ10 levels are declining with age, and the medications meant to protect your heart are further draining them. If you're finding this information helpful, please give this video a thumbs up and subscribe for more insights like this. Over 60% of seniors taking statins report muscle pain, fatigue, or weakness, many of which are tied to CoQ10 depletion. For most older adults, a daily intake of 100 to 200 milligrams of CoQ10 is recommended. However, if you're on statins, you may benefit more from 200 to 300 milligrams per day. While it's true that foods like organ meats, fatty fish, and whole grains contain CoQ10, the amounts are typically too small to provide therapeutic effects, which is why supplementation is often necessary. We recommend Doctor's Best high-absorption CoQ10 with bioperine, a highly effective supplement that improves absorption by up to 30% thanks to its inclusion of black pepper extract. It also contains the active ubiquinol form of CoQ10, which means your body can use it right away, no conversion needed. Another standout option is Canica ubiquinol from Canola Ultra CoQ10. Clinical trials show its patented water-soluble formula absorbs up to 300% better than standard CoQ10. This is especially important because CoQ10 is fat-soluble, which can make it difficult for seniors, particularly those with digestive concerns, to fully absorb it. Coming in at number 5 is vitamin D. While it's widely known for its role in maintaining strong bones, vitamin D is also absolutely essential for keeping your muscles strong and functional as you age. That's because vitamin D receptors are located throughout your muscle tissue, and when these receptors are underactivated due to deficiency, muscle mass and strength begin to decline. Multiple studies have shown that seniors with healthy vitamin D levels enjoy significantly better strength, coordination, and muscle endurance compared to those with deficiencies. In fact, one landmark study found that older adults who supplemented with vitamin D saw a 20% reduction in falls, a direct indication of improved muscle performance. Vitamin D deficiency is alarmingly common, affecting more than 40% of older adults. The risk increases for individuals who are homebound, have limited sun exposure, or live in northern climates. If you're experiencing unexplained muscle weakness or fatigue, a simple blood test can reveal whether you're deficient. Vitamin D also enhances calcium absorption, which is critical for proper muscle contraction and function. When your body lacks sufficient vitamin D, your muscles can't properly utilize calcium, leading to reduced strength and poor coordination. For adults over 65, the recommended daily intake typically falls between 800 and 1000 IU. However, many health professionals suggest a higher range, 1000 to 2000 IU per day, especially for seniors who don't get enough sunlight. Foods like fatty fish, such as salmon and mackerel, along with egg yolks and fortified items like milk and breakfast cereals, are excellent dietary sources. Still, for many older adults, dietary intake alone isn't enough, and supplementation becomes necessary. One of the best options we recommend is nature-made vitamin D3 2000 U soft gels. This supplement uses vitamin D3, also called cholecalciferol, which research shows is up to 87% more effective at increasing blood levels than D2. Plus, nature-made holds USP verification, meaning its purity and potency have been independently tested and confirmed. If you prefer a liquid alternative, Nordic Naturals Vitamin D3 is a standout. Each drop provides a precise 1000 IU dose, making it easy to adjust according to your needs. It's also formulated with olive oil as the carrier, which significantly improves absorption, unlike lower-quality brands that rely on less effective carrier oils. Coming in at number 4 is vitamin B12, a vital nutrient whose absorption declines significantly with age, putting seniors at risk for muscle deterioration. Vitamin B12 is essential for healthy muscle function because it plays a key role in keeping your nerves functioning properly. When your body lacks enough B12, the communication between your brain and muscles starts to break down, resulting in weakness, poor balance, and eventually muscle atrophy. Unfortunately, many older adults overlook these warning signs, often attributing fatigue or clumsiness to aging. But what they may actually be experiencing is a slow-developing B12 deficiency. What's even more concerning is how frequently these symptoms are misdiagnosed as other age-related conditions. Regular blood testing is crucial, especially for those taking medications like metformin or proton pump inhibitors, both of which can greatly reduce B12 absorption. Vitamin B12 is vital for producing healthy red blood cells, which are essential for delivering oxygen to your muscles. Without enough oxygen, your muscles struggle to generate energy efficiently, leading to fatigue and reduced ability to perform daily tasks. B12 is also key to maintaining the myelin sheath, the protective covering that insulates your nerves. When this sheath deteriorates due to a B12 deficiency, the brain's signals to your muscles can become disrupted. The result? Tremors, an unsteady gait, and difficulty with precise movements. For adults over 60, the recommended daily intake is 2.4 micrograms, but because absorption declines with age, higher doses are often necessary. Naturally, B12 is found in animal-based foods like meat, fish, dairy, and eggs. However, up to 30% of adults over 50 suffer from atrophic gastritis, a condition that limits their ability to absorb B12 from food. In these cases, supplementation, or even B12 injections, can be essential. One top-tier option is Jarrow Formula's Methyl B12. This supplement uses methylcobalamin, a highly absorbable form of B12 shown to stay in body tissues longer than the more common cyanobalamin. Their sublingual lozenges dissolve easily under the tongue, bypassing the digestive tract where absorption often falters in seniors. Another excellent option is Garden of Life's Vitamin Code Raw B12. This whole food-based supplement includes probiotics and digestive enzymes, increasing absorption by up to 60%, a real advantage for older adults with digestive challenges. Its convenient spray format also makes it ideal for those who have difficulty swallowing pills. Coming in at number 3 is vitamin C, an often underrated muscle ally. While it's best known for immune support, its benefits go far beyond that. Vitamin C plays a pivotal role in muscle maintenance as you age, helping in several critical ways. One of its key functions is supporting collagen synthesis. Collagen isn't just for your skin, It forms the connective tissue framework that surrounds and stabilizes your muscles. When collagen production dips due to low vitamin C, these structures weaken, leading to muscle instability and a higher chance of injuries like strains and tears. Studies show that seniors with higher vitamin C levels demonstrate noticeably better grip strength and overall muscle function than those with lower levels. Beyond its well-known benefits, vitamin C shines as a powerful antioxidant that actively protects your muscle tissue from oxidative stress. As you age, your muscles endure damage from free radicals, unstable molecules that gradually weaken muscle fibers and contribute to atrophy. Vitamin C combats these harmful agents, helping preserve both muscle integrity and function. Vitamin C is also key in supporting cellular energy. It aids in the production of carnitine, a compound your body relies on to convert fat into usable energy for muscles. When vitamin C levels are low, this conversion process slows down, leading to reduced muscle energy, increased fatigue, and overall weakness. Seniors are typically advised to consume 75 to 90 milligrams daily. However, many health professionals recommend higher doses, between 200 and 400 milligrams per day, to better support muscle health and recovery. Natural sources of vitamin C include citrus fruits, bell peppers, strawberries, tomatoes, broccoli, and even white potatoes. Because vitamin C is water-soluble and not stored long-term in your body, maintaining a steady daily intake is essential. If you're exploring supplement options, one excellent choice is foreign research vitamin C with flavonoids. This advanced formula combines ascorbic acid with citrus flavonoids, enhancing absorption by 35% and extending vitamin C activity in muscle tissue, according to peer-reviewed university studies. For even more potent absorption, consider lipospheric vitamin C by Livin Labs. Its revolutionary liposomal delivery system encapsulates vitamin C in phospholipids, boosting bioavailability by up to 98% when compared to traditional supplements. This means more vitamin C reaches your muscle cells, exactly where it's needed most. Coming in at number 2 is magnesium. Though it's technically a mineral, its role in preserving muscle health is so critical that overlooking it can be a costly mistake. Magnesium deficiency is widespread in older adults and impacts muscle health through several pathways. It is essential for proper muscle contraction and relaxation, functioning as a natural calcium blocker that allows muscles to relax after they contract. When magnesium levels drop, your muscles can't relax fully, causing persistent contractions, cramps, spasms, and lingering tightness, all of which accelerate fatigue and breakdown. Additionally, magnesium is involved in the formation of ATP, the primary energy molecule that powers all cellular functions. Muscles are energy-intensive tissues, and without magnesium, endurance and strength begin to wane. Magnesium also supports protein synthesis in muscle tissue. Studies show that even mild magnesium deficiency can interfere with your muscle's ability to build and maintain protein structures, exacerbating age-related muscle loss. The recommended daily intake is 320 milligrams for women and 420 milligrams for men. Top dietary sources include dark leafy greens, seeds, nuts, legumes, and whole grains. Yet, research reveals that more than 60% of older adults fail to meet their magnesium needs through food alone. Complicating the issue further, many commonly prescribed senior medications, like diuretics, PPIs, and some antibiotics, can further deplete magnesium levels, intensifying the risk of deficiency. Symptoms like fatigue, muscle cramps, and overall weakness are often misattributed to the aging process. This leads to widespread underdiagnosis of magnesium deficiency among seniors. For supplementation, we strongly recommend speaking with your doctor about high-absorption magnesium options. One standout choice is magnesium glycinate, which research shows offers up to 4 times the bioavailability compared to the more common and less effective oxide form. Additionally, it's gentler on the stomach and avoids the laxative side effects that often cause seniors to stop supplementation prematurely. And finally, number 1 on the list, creatine. Often associated with young athletes, creatine may be the most underutilized supplement among older adults seeking to maintain strength and muscle mass. Creatine functions through a distinct biological pathway, making it a powerful and unique ally in preserving muscle health as you age. Here's why it matters. It increases your muscle's stores of phosphocreatine, which fuels the rapid production of ATP, the energy your muscles need for short bursts of activity like climbing stairs, standing up from a chair, or preventing a fall. These everyday movements become harder with age, compromising mobility and independence. Creatine is especially valuable for seniors because it stimulates the growth of satellite cells, which are crucial for muscle repair and growth. Research shows that by age 60, satellite cell activity can decline by up to 50%, drastically reducing your muscle's ability to regenerate. However, creatine supplementation has been found to increase satellite cell activation by as much as 35%, reviving muscle regeneration and promoting strength. In clinical trials involving seniors, the combination of creatine and light resistance training led to a 14% boost in strength and an increase of 2.2 pounds of lean muscle in just 12 weeks, results that would otherwise take far longer to achieve through exercise alone. This improvement can greatly enhance daily living tasks and help maintain independence. Seniors are advised to take 3 to 5 grams of creatine per day, without requiring a loading phase, a simpler approach than the regimens followed by younger athletes. While creatine is found naturally in red meat and fish, achieving therapeutic levels through food alone would require eating over 2.5 pounds of beef daily, making supplementation not just helpful, but essential. One top-tier option is Optimum Nutrition's micronized creatine monohydrate. This pharmaceutical-grade supplement is finely processed to increase surface area by 20 times, significantly improving solubility and absorption. This is especially beneficial for older adults who may experience slower digestion or reduced nutrient uptake. Best of all, creatine boasts a stellar safety record, with over 200 peer-reviewed studies supporting its use. Even for long-term supplementation, it's considered safe for seniors. And exciting new research points to brain health benefits, including improved cognition and memory, offering seniors a dual advantage. When combined, these 6 powerhouse nutrients, CoQ10, vitamin D, vitamin B12, vitamin C, magnesium, and creatine, deliver a synergistic effect that far surpasses what any one of them could offer alone. Together, they help safeguard your strength, support energy production, and promote muscle resilience for the years ahead. Think of these nutrients as your personal team for muscle maintenance, with each one playing a unique and vital role in protecting your strength, mobility, and independence. While supplements can help fill in nutritional gaps, the foundation should always be a well-rounded diet. Whole foods provide not only essential vitamins but also a range of natural compounds that work together to support long-term muscle health. Remember, maintaining muscle isn't just about looks. It's about staying independent, reducing the risk of falls, keeping your metabolism active, and enhancing your overall well-being as you age. By ensuring your body receives the right nutritional support, you're making a powerful investment, one that supports mobility, vitality, and a higher quality of life in the years ahead. If you suspect you may be lacking in any of these 6 essential nutrients, be sure to consult with your doctor. Routine testing in the right supplements can help proactively address deficiencies, slowing or even reversing the effects of muscle decline over time. We'd love to hear from you. Which senior health topic should we explore next? Your feedback plays a key role in shaping future content. Whether it's natural solutions for joint pain, ways to enhance memory, tips for supporting heart health, or any other concern close to your heart, let us know in the comments below. And tell us, which supplement from today's list surprised you the most? Have you personally tried any of them? Share your experience in the comments. Your story could inspire and inform someone else on their journey to better health. Thank you for watching.